Dr. Tracy Page, Wisconsin Institute of Functional Medicine. Welcome, Dr. Page. First question, what is IV therapy?
Yeah, a lot of people think of it as vitamins in a bag, but it's a little bit more than that too, because we also put minerals in there, amino acids, and even antioxidants.
Now, we were talking earlier, this is a big demand, and I don't know if people really fully expect what's going on. So who do you see normally who want this?
So it can be different types of patients. So it could be someone who's ill and who doesn't feel well, has fatigue, low energy, patients who have GI symptoms, so they're not absorbing their nutrients. Right. And it can be someone who's just athletic and they want hydration, or just prevention and wellness.
Right. And so when we come to your practice, we'll go through a questionnaire. You'll discern what we need, right?
Correct.
Yeah. All right. So what do we expect if this sounds appealing and I want that? What happens the first time I walk in?
Well, first of all, we always want to keep our patients safe. I say we never want to cause a problem while we're trying to fix one.
Sure.
So I do run labs on my patients to make sure their kidney function is good, to make sure they have certain enzymes to break down the different things that are in the IV therapy. So that's the very first thing we do. And then we talk about symptoms to make sure that we're matching them up with what they need.
Now, I would think that the IV therapy, as opposed to maybe an oral supplement or something like that, would be far more effective because you're getting it straight in. Is that right?
Yeah, you're correct. So it goes into the venous system, so there's no, it's 100%, so you don't have to worry about absorption. So typically when we take an oral supplement, and for most people I always recommend food first to get your vitamins and nutrients, and then if you're taking an oral supplement, we have to expect that the stomach is going to break it down, and then the small intestines is going to absorb it. So some people that doesn't happen, and that's where IV therapy comes in.
Right, because you may be having those problems that prohibit those things, and which is why you need the IV therapy.
Correct.
I'm learning right now.
Yes.
All right, so you were telling me about some of the kind of fun treatments you have. Why don't we walk through that quick?
So there's all different types of IV therapy. So there's the ones that the ladies like for hair, skin, and nails. So that's the Fountain of Youth. That's going to have glutathione, some vitamin C, your B vitamins. But then there's one for hydration. There's one for natural defense. So like if your immune system, if you feel like someone who gets sick often, then that can be a really good one as well.
Well, these are, I think, fantastic because you're telling me the demand is so high for these. So I think if anybody's feeling a little run down or has some of these symptoms, they should come check out how IV therapy can help them.
Correct.
Well, thanks so much for being here, Dr. Page, and thank you for watching To Your Health.